So we're going to start off with some kinesiotaping of the knee, and then we're going to get more into the strapping techniques for more acute athletic injuries. So KinTaping, especially in the clinical setting, is really nice in terms of a variety of conditions. So osteoarthritis of the knee, any type of patellar tracking issues, patellar tendinopathies, etc., etc. So we'll start with patellar tracking, and then we can incorporate some other tape jobs as well. So obviously when we are supporting a patellar tracking issue, we want to track the patella more medially. So a lot of people will do KinTape taping for that, but from a kinesiotape you can also promote that as well. And we also want to do a VMO facilitation technique. So I'll show you that one, and then we can incorporate some other jobs as well. So for this, you want to measure from the kneecap about midway to VMO. Again, you can prime your area with sanitizer, maybe put a bit of pre-tape spray on. You're going to round out your edges of your KinTape, and then you're going to do a Y tape. You're going to do a two-tailed approach, and then you're going to round those edges out. Okay, and then you're going to rip the base of your legs here, and obviously take off your anchor. So you want to measure down to about the level of the kneecap, and we're going to come up a little higher because we are going to put some stretch through here. So we're going to start on VMO. She's going to straighten out her leg, and then she's going to bring it back down. Okay, so she's come up into extension, knee extension, and then you're going to come down into flexion. And we should end off just before the kneecap there. And again, you're going to come up into knee extension, and then what we're going to do is come around the kneecap and support it from either side. So when she comes down into flexion, we're going to come around the kneecap and under, and she comes back up into extension, and we're going to come around the kneecap and under. Okay, so this is going to put a little bit of facilitation through VMO, but it's also going to be giving a little bit of feedback to the patella to hopefully track it a little more medially. So this is a nice tape job for tracking issues. And you can also incorporate other tape jobs into this as well. So if they also have a patellar tendon issue, then you can combine a patellar tendon tape job. So let's put that on top as well. And similar to patellar tendon kinesiotaping, if they have, if your patient has osteoarthritis of the knee, a similar tape job will help as well, because when supporting that kneecap, any type of chondromalacia patella will benefit from this type of facilitation. So again, we do a two-tailed approach. We round out our edges and rip the base. So we're going to anchor down at the level of the patellar tendon. So we're just going to come a little more distal to that, maybe around the tibial tuberosity. Lay it down. Okay, she's going to come into knee extension, and then as she comes down into flexion, we're going to lay our tape down, and again flexion, and then you can come onto VL. And you can come on either Rec-Fem or you can come on VMO. Here we're just going to stay on Rec-Fem because we already have one on VMO. So as she comes down, hang on, come back here. She comes down in flexion. We're going to come up to VL. And then come down, and we're going to come onto rectus femoris. And if you really want it to look neat, you could have done this one first and then had this one come around. Either way, you've got two techniques now combined. So you've got VMO facilitation, a little bit of medial tracking, and then you've got a little bit of facilitation on the patellar tendon, as well as vastus lateralis and rectus femoris.
I guess you wouldn't see it wouldn't contradict the